4 armed robots hover over patients, operating instead of human surgeons. It sure looks like medical technology is advancing into the realm of science fiction. But according to Dr. Liu, who has pioneered the use of robots in hospitals, robot-assisted surgery might soon become common practice in China.
Our robots are usually fully booked. On average, I now have 2 to 3 robotic surgeries every day.
Dr. Liu specializes in minimally invasive treatment of malignant pancreatic, liver, and gallbladder disease, and he's increasingly relying on the bots.
The robot offers a high-definition 3D visualization that allows me to see fine anatomic detail during the procedure. The 4 robotic arms that I'm able to control with my hands and feet provide me with fine motor skill for complex suturing and dissection. Overall, it improves dexterity and reduces tremor.
It's also allowing patients to heal much faster than the traditional open surgical approach.
When compared with open surgeries, robotic surgeries have smaller incisions, less blood loss, much better visualization, less post-operative pains, and as a result, a decreased time of stay in hospital.
For patients, that means an invasive pancreatic cancer surgery has now transformed from blood and guts to bits and bytes.
I'm being given a second life, and I'm grateful for what the doctors did with the surgical robots.
But these technological advancements aren't one size fits all. Patients have to undergo diagnostic tests to see if they are eligible for the operations. Surgeons have also to be properly trained to use the robot equipment.
So here's a demonstration of the robots that's being used here at this hospital. It's got 3 core components: a patient car, which has the robotic arms, a surgeon console, and a vision system. This is really the brain of the system, which relays information between the first 2 parts. Now, the robot doesn't do anything on its own. It's more of an extension of a surgeon's eyes, arms, and hands. And this one doesn't come cheap. It costs around $2 million US, which could mean increased costs for procedures and limited accessibilities for hospitals.
Critics also point out that more technology doesn't necessarily mean better quality healthcare, citing a cheaper laparoscopic surgery sometimes could also do the trick. But Dr. Liu says the laparoscopic platform alone hasn't been adequate to perform certain complex operations. And now the research and developing team here at the PLA General Hospital is participating in designing China's own surgical robots, challenging the dominance of established players by offering greater affordability and technological innovation.
We already have the prototype, and hopefully it will be put into large-scale manufacturing soon to meet the market.
Surgical robotics also opens the door for telesurgeries, and beyond that, autonomous robot surgeon. For Dr. Liu and his team, these robotic surgical tools aren't just advancement for medical technology. They're shaping the landscape of healthcare for patients. And the potential for what they could do in the future could possibly change medicine forever. Li Qiuyuan, CCTV, Beijing.